Hi, everybody. I'm one of the founders of a company that helps hospitals around the world implement artificial intelligence to make them more efficient. And today we are going to talk about how one hospital group implemented our solution to save $3 million in just 2 months. Stay tuned. Today we are going to cover 4 areas where AI can have a huge impact in your hospital or health system. Number 1, streamlining administrative workflows. Number 2, optimizing resource allocation. Number 3, leveraging AI to improve patient outcomes by identifying patients that might be at risk for certain conditions. And number 4, increasing operational efficiency. I run a company that helps hospitals around the world implement artificial intelligence to make them more efficient. We have worked with hundreds of hospitals, from small community hospitals all the way up to large health systems like HCA Healthcare. And what we see time and time again is that the hospitals that are successful with implementing AI and seeing big results have one thing in common: it starts at the top. Leadership needs to be willing to take risks, try new things, and really push the organization forward. You need a culture that is open to change and not afraid of change. And most importantly, you need to have some quick wins early on so that you can build momentum and get everyone excited about what AI can do. That brings me to the first use case that we are going to cover today, which is streamlining administrative workflows. One of the best ways to get quick wins with AI is to look at those manual, rule-based tasks that are taking up your nurses' and doctors' time, that are really adding no value but are easy to automate with AI. The perfect example of this is a task that we call order reconciliation. Nurses spend countless hours every day entering orders into the computer and then having to reconcile those orders with the doctor's actual plan of care. Our solution automates this process by extracting the doctor's plan of care directly from the medical record, reconciling it with the existing orders, and then flagging any discrepancies so that the nurse can quickly address them. This saves the nurse time, improves patient safety by reducing the chance of medication errors, and also improves communication between the nurse and the doctor. We have seen organizations that are able to reduce the time spent on order reconciliation by up to 80%, which translates to significant cost savings and increased nurse satisfaction. The next area that we are going to talk about is optimizing resource allocation, and there are many different ways that you can do this with AI. But one of the most impactful is bed management. One of the biggest challenges in any hospital is balancing supply and demand. On the demand side, you have patients that need beds. On the supply side, you have beds that are available but also need to be cleaned and stocked and ready for new patients. One of the biggest reasons for delays here is the lack of visibility into when a bed is actually going to become available, because a lot of this information is stored in disparate systems, and it's not really shared across the organization. For example, let's say that a patient is on a ventilator and you don't know when their ventilator is going to become available. Or let's say a patient needs a sitter, but you don't know when that sitter is actually going to be available. Our solution solves this problem by giving you real-time visibility into bed availability and also by automating much of the bed management process. We have seen organizations reduce their boarding and diversion time by up to 50%, which has a huge impact on the bottom line. The next way that AI can help you optimize resource allocation is by helping you better manage your staff. AI can help you with everything from scheduling to performance management to hiring. In fact, AI can analyze historical data such as patient census and acuity levels to predict future staffing needs. This allows you to hire the right staff, schedule the right staff, and also develop the right staff. The third use case that we are going to talk about today is leveraging AI to improve patient outcomes by identifying patients that might be at risk for certain conditions. One of the great things about AI is that it can analyze vast amounts of data very quickly and then identify patterns and insights that would not be possible for humans to do. The perfect example of this is sepsis. Sepsis is a life-threatening condition that occurs when the body's response to infection goes awry. The problem is that sepsis is very difficult to detect because it can mimic other less serious conditions. In fact, many patients with sepsis are initially misdiagnosed. Our solution is able to analyze a patient's vital signs, lab results, and other clinical data in real time to identify those patients who might be at risk for sepsis. Early identification of sepsis allows for earlier intervention, which can significantly improve patient outcomes. In fact, we have seen organizations that are able to reduce their sepsis mortality by up to 50% using our solution. Other examples of this could be things such as readmissions, falls, ulcers, pressure injuries, and other things that are costly for the hospital, but also really impactful for the patient. The fourth way that AI can help you streamline operations is by making it easier to find information. One of the biggest challenges in healthcare is the fact that information is stored in so many different places. This makes it difficult for clinicians to access the information they need, leading to wasted time and duplicated efforts. Our solution helps to solve this problem by providing a single platform for all hospital operations. This platform provides a central source of truth, making it easier for clinicians to find the information they need. In addition, our platform can also help you automate many of your hospital's processes. By automating these processes, you can free up your staff to focus on higher-value tasks, ultimately leading to improved efficiency and cost savings. In conclusion, AI is transforming the future of hospital administration and operations. By embracing AI, hospitals can streamline administrative workflows, optimize resource allocation, improve patient outcomes, and increase operational efficiency. To successfully implement AI in your hospital, it's important to start with a clear plan, assemble a cross-functional team, engage with your staff, ensure data privacy and security, and measure results, and adjust accordingly. By following these steps, hospitals can leverage the power of AI to drive positive change and achieve better outcomes for their patients and staff. So now I want to talk about how one hospital group was able to use our solution to save $3 million in just 2 months. The story of how one hospital group saved $3 million with our solution is a great example of how AI can transform the way hospitals operate. This large academic medical center was struggling with high costs and low margins, just like many other hospitals across the country. They were looking for ways to improve efficiency and reduce waste, and that's when they discovered our solution. After implementing our solution, they were able to reduce length of stay by 3 days per admission and reduce the cost of care by $10,000 per admission. This resulted in a total cost savings of $3 million in just 2 months. But the benefits did not stop there. The hospital also saw a decrease in hospital-acquired conditions and readmissions. In fact, they reduced hospital-acquired conditions by 40% and readmissions by 20%. This is a remarkable achievement that demonstrates the power of AI to improve patient outcomes and reduce healthcare costs. By embracing AI, this hospital was able to achieve significant cost savings while also improving patient care. This is a win-win scenario that shows how AI can transform the future of healthcare. Thank you for watching. If you enjoyed this video, please give us a like and subscribe to our channel. We look forward to seeing you in the next video.